Hi, everyone. I'm Australian SLP working in the Philippines. Oh, my goodness. We have a couple assistants from the Philippines. We love you guys over there. Is there a prerequisite course required before taking foundations? No, this is the prerequisite. So we start with the foundations, and then we go into Myocircle, which is the advanced course. So on Airway Circle, we kind of try to come up with all the courses that you need. Whenever you first go into this world, we know that it's really hard to know exactly which path to take. So we decided to do a path for you guys. You start with foundations. We also have a business course. And then afterwards, we do the advanced course. So we have step-by-step, pretty much in a year, you have everything that you need. So, hold on a second, Lari. Tu me traz pouco de água, por favor, que eu vou estar falando sem parar. Thank you. I'm getting some water. All right, here we go. Let me make sure you guys can see my beautiful screen. And if I do, presenters mode, let's see. Can you guys still see the right thing? You guys can still see the right thing, right? Is it full screen for y'all? Okay, perfect. Making sure it's still full screen for you guys. Here we go. Y'all stop me, okay? If you need to. Okay, perfect. I see y'all's comments. Oh, good. It's so good to hear your comments. All right, here we go. So what are some of the red flags of myofunctional disorders? Let's talk a little bit about what we need to know. So if you're new around here, myofunctional disorders are issues with the muscles and functions of this whole area right here. So we're talking about the mouth, the face, the throat, muscles. These disorders can affect essential functions like chewing, swallowing, breathing, speech. I'm not a speech pathologist. We don't specifically, of course, deal with speech, but sometimes patients who have articulation issues that a speech pathologist can help, or some myofunctional therapy exercises can help correct the articulation, so the tongue position, not the speech, okay? And if left unaddressed, it can lead to significant health and developmental challenges. I love this photo that it shows the top one. You guys have all seen this. Somebody, if they grow up to what they're supposed to look like. So if you're breathing through your nose, if you're chewing hard foods, if you're doing all the things that you're supposed to do, it's going to help your skeletal structure grow. Now, the guy on the bottom is kind of like me. And what happened over there? You know, that's a person that was super, super tired all the time. Thank you very much. Breathing through their mouth. Okay. Hold on, guys. I have Amanda helping me with the bingo. Did you guys get your bingo cards? There's a link in the description, she said, and it generates a card for every user every time it's clicked. If you guys have not gotten that yet, get your bingo cards, because I'm going to give something away at the end of this. Red flag is in full screen. Very good. Okay, bingo cards. Give me thumbs up if you have your bingo cards. So every time that I say a word from the bingo card, let's see if she has, can you send me the link here, please? I'm going to post on the comments the link. So if you guys have not gotten your bingo cards, you can. We're going to do a fun game. So whoever fills up one, straight. So we're going to do two winners. Whoever does a whole straight first, and then whoever does the whole thing. Yes, have bingo card. Oh, good. Okay. So every time that I say a word, you guys are going to scratch that off. Okay. You're going to take a photo and send it to me. The first person, you guys, of course, put really big over here, bingo, to let me know that you have filled the whole card. If you guys have not done it yet, copy. I'm going to post it in the comments. And whoever didn't get their bingo cards yet, please do. And while we're waiting for everybody to get the bingo cards, let me really quickly share and tag everyone or all the followers on Airway Circle. Here we go. And I forgot to share this. It's not letting me do the followers. I forgot to share this in some groups, like the dental hygiene groups. So after we're done with the live, you guys can help me out. That'll be amazing. Let's see. Smile. Sorry, right here. I want to share in this one real quick. Okay. And the Airway Circle. Let me just do in their Airway Circle real quick. So you guys know if I'm looking down, that's usually what I'm doing. And I'll just do everybody on Airway Circle. All right, bingo cards ready. Has anybody gotten a word yet? We're going to have some prizes. Okay, here we are. Let's do everyone. Everyone, we do it live. Come play bingo. And then, okay, I put the link there. Ta-da! Okay. Lots of words already. Oh my gosh, you guys are gonna win. Okay, perfect. So let's keep going. Of course, everybody wants to look like the top guy with your beautiful white jaw, lips closed. But what's happening? Why are so many people not growing to their full potential? And it's not growing to be good looking like the top guy, you know? It's just growing to your own full potential. Are we all, you know, let's use what mewing people do. Are we all going to probably look better if we're breathing through our nose, if we're less tired? 100%. The second that you start getting more oxygen into your body, even your skin looks better. So let me see where I am. I have too many screens open. I love to start with this photo. I have a mentor who passed away not long ago, and here he is. This guy right here, Dr. Tom Cohort. And he taught me that a lot of times you can just look at our patient's eyes and it will give us the whole story. This little boy is one of my favorite patients. I'm not sure if I share everything about his case over here, but you can just literally start looking at your patient's eyes. You know, we're all trained in the dental field to look in the mouth, to be looking at our teeth, but what story are our eyes telling us that we are completely ignoring? So what do you see over there on the top? We're going to look at it clinically first. So clinically, I see white sclera underneath the eyes. What does that mean? Can you guys see my cursor? Or can you see my cursor here? I'm not sure which one works. Okay. I think it's this screen that you guys can see my cursor. I'm not really sure which one you can see. But anyways, the white sclera underneath the eyes is this whitish area that you can see underneath the eyeball. The eyes are supposed to be kind of like the sun going up, with more of the top of the eyeball seen than the lower part of the eyeball. But what's happening with that child that all of a sudden changed after 4 sessions? Why do his eyes look like that clinically? What else do we see? Oh my gosh, my door was open whenever we're moving, so there's flies inside my house. We also see these little lines underneath. It's a little fold underneath the eye. Those are called Denny Morgan lines. It indicates 78% chance of somebody having allergies. So usually if I see that on my patients, with every myofunctional therapy patient, we address allergens and how to improve the air quality. So a lot of times just by itself, they get a lot better. However, sometimes we do have to refer them to an allergist or to an ENT to look further into anything else that could be possibly bothering their breathing. So what else do we see? Of course, it's a different photo, and his eyes are very dilated on the first one. I'm not sure what the lighting was like. However, not clinically now. We mentioned the white sclera under the eyes. Oh, how sad the eyes are. You know, the tops are like almost folded on top of it. A lot of these children, one thing that you guys are going to notice, children that have myofunctional disorders, they always have their head down. They usually have their head down. So there's a couple reasons that you guys are going to hear why somebody's eyes may look like that with a white sclera. When I was learning myofunctional therapy, I heard a wonderful doctor talk about the maxilla being too small. So if the maxilla was too small, it didn't grow to its full potential, you could see more of this white sclera. Also, with the bags under the eyes, we call this venous pooling. He actually, on the first one, he has a little bit of reddish. That's more allergic shiners also with the allergies. But if it's purple and puffy, we call that venous pooling. So Dr. Ben Morali also actually is the one that taught me that you have a little suture right here where the arteries are supposed to go through, or maybe they're veins, or there's a vein that's supposed to go through here. I can't remember, guys. Infraorbital vein, I don't remember, you guys. I need to look it up. But anyways, it goes through this suture right here. And if the maxilla did not grow to its full potential, it squeezes because the little hole is smaller. So it squeezes that suture right there and it causes the blood to pool right here. So that's how I heard about the venous pooling, the bags under the eyes. With the white sclera, what I started noticing was that just after myofunctional therapy, that was improving. Sometimes the purple also was improving and the allergic shiners. But why? So there's a couple reasons. One, most of these patients have their head low. And you guys can all look in the mirror right now. If you put your head down and you look up, all of a sudden you can see more of the white sclera. So let's go further. Why? What are some reasons why somebody will have the head a little bit lower? I want this to be interactive. You guys are welcome. What are some reasons that our head would be a little bit lower? How heavy is your tongue? Super, super heavy, right? Our tongue is super, super heavy. So if the tongue, very good. Yes, because we're tired. You notice also the outside corners of the eyes. They're almost lower than the inner corner of the eyes. Those are called eye canting. Forward head posture. But usually the reason why the head is down is because the tongue is heavy and the tongue is not in the right position. If the tongue is not lightly suctioned to the roof of the mouth, the head is going to be low automatically. As soon as you get the tongue to go to the top of the mouth, the patient does this. So a lot of times we notice that white sclera improve because it's exactly Magda or Megagupta. Head posture follows tongue position 100%. So sometimes it's something super simple that as soon as you get the patient to hold the tongue up there, all of a sudden they are sitting up straighter. I love the side profile photos that it shows, you know, the patient like this, and all of a sudden they're like this after just a few sessions of myofunctional therapy. However, what is another thing that we have to make sure that we do before a patient can have this beautiful tongue posture and head posture? What is the number one thing that we have to work on? Anybody? I'm looking over here in the comments. There's so many of you. Thank y'all for being here. How exciting. Nasal breathing. Thank you. It is not fair. You are my student. Megan is my student. Here she is. She's amazing, by the way. Guys, just to let you guys know, actually, Megan, I'm not sure if you would be willing to talk at the end of this, but Megan took foundations last year, and she, as soon as she finished the course, was it the next day, Megan? She saw a patient. She had her first patient. So that's usually a question that people have. You know, if I take my first course, am I going to feel ready to see patients right away? First of all, I want to tell you guys that the first course you take is going to feel overwhelming. any course you decide to take. If it's 28 hours, if it's 60 hours, either one is going to feel overwhelming because this is all new information. Think about everything that you have learned from dental hygiene. You know, let's say that the 2 years of dental hygiene was given to you guys in 4 months. You'd be going crazy. It's a lot of information, right? Yeah, Ashley is saying I can attest to that. And whatever course you take, it's always going to feel like, oh my Lord, what is this world? What do I do now? However, several of our students were able to see patients right away afterwards. So that is super, super, super exciting. However, whenever you take your second course, all of a sudden you go, now it makes sense. Like you are going to be able to connect the dots on the second course that you take. So if you have already taken a course and you're still feeling lost, when you take foundations, you're going to be like, oh, that makes so much sense. And then whenever you take Myofunctional, your mind is just blown with Myofunctional because we really just throw every, I don't want to say that, but we throw every course out of the water just because it's absolutely insane what we teach in there. And the people that, I'm not sure if there's anybody here who has taken Myofunctional, you guys are welcome to comment and let us know your experience. But here we go. When is the next Myofunctional? Next Myofunctional is August of 2026. So what I decided to do is do a foundations right now in August. We're almost full, by the way, already for these foundations. We only allow a certain number of students because it takes a lot of the mentors' time to focus on the students. So we're doing foundations August of 2025, and we're going to do foundations again in January. So from next year, 2026, from that year on, foundations is always going to be in January. And Myofunctional is always going to be in August. At least that's what we're planning right now. Because you need foundations now to take Myofunctional. The reason why we decided to do that is because we would have people who have taken 3 different courses come take Myofunctional, and they were still asking questions about foundations. Foundations, we focus heavily on tongue ties, on evaluation. And especially our tongue tie release protocol is very, very good and very heavy. And it's really, really good on foundation. So we want everybody to take both just because they complement each other so well. Do you match the mentor to the profession of the student in the foundations course? So we don't have one mentor per student. We just have a few mentors that help throughout the course. We have several different guest speakers that have recorded classes for us, so you get to learn from them also. However, whenever we get to the answering questions on the WhatsApp group, we'll have a WhatsApp group that you guys can ask questions. You can post patients' photos. You can use that group as a community to speak to each other and to learn from each other. The mentors are in there, and we are answering everybody. But there's not a one-on-one. So after, I'm going to say this at the end, but after we finish foundations, we decided to do this and no other courses doing this. It's super exciting. There are 4 months of follow-up because of the fact that most people feel kind of like lost after the first course. Oh my gosh, they don't know what to do. So we have set up already a 4-month mentorship. So we're going to meet once a month for 4 months. So as you guys start seeing your first patients, you're going to have that help. Yeah. So do you match the mentor? Yeah. So we're going to have, and actually every course now we're going to have different mentors. So you guys keep an eye out to find out. It's pretty much Tamara and I, and then we have a few other mentors for foundations. I will release their names soon. And for Myofunctional, we have some other different people. Let's see. Okay, so my son was welding out at the beginning. Welding out in the beginning, is that what it says? Are we listening and filling out the bingo card as you go? Yes. When we hear the word, yes. So as soon as you hear the word, you scratch it off. If you get a whole line, it can it be diagonal, Amanda? Should we do a diagonal? So straight, full, side, or diagonal we can do. You guys right over here, bingo. It has to be the first person, and then take a photo and send it to me. I'll give you my number. Send it to me, and you're going to get one prize. I'll let you guys know what that is soon. And then for the person who gets the whole thing first, you're going to get a bigger prize. So there we go. Yeah, so there are several guest speakers that are SLPs, that are hygienists. We have some dentists also that are guest speakers that you may be seeing on the website who are going to do certain courses. And then Myocircle, we go more on heavier on mentor, but the foundations, it's mainly Tamara and I and a few other girls, but I'll share with you guys who they are very soon. If you guys have not seen the dates yet, they are on the website, all the way on the bottom of their foundations. I'll show that in a little bit. I promise that I'll get through this presentation, but to finish this slide, please look at your patient's eyes. They tell a story. And the first time that that mother looked at me and said, Renata, you have found my child behind those tired eyes. There's my little boy. I don't know if I share about him, so I'll tell you guys. This little boy is 5 years old, slight ADHD, slight autism. He couldn't sit on the chair, but it was like around COVID. And I told the mom, you have to go see somebody in person. And she was like, nope. I have to, I can't, Renata, I have to do this. And I said, okay, you're going to be my co-therapist. It's not going to work unless you guys do this at home. So she was wonderful. And very quickly, after 4 sessions, I think we did it every 2 weeks. After 4 sessions, he was taking melatonin every night to go to sleep. No more. He was wet in the bed every night. No more. He was waking up throughout the night. No more. He was taking a whole hour to fall asleep, even though he was taking melatonin. No more. All we did was work on nasal breathing and tongue position. I didn't do anything else. There was no expansion, no tongue tie release. And in 4 short sessions, this child's life was already completely changed. Now the teachers are going, oh my gosh, what happened to him? What is he doing? He's so quiet. He's doing so good. He's paying attention in school. Now he's able to actually sit in front of the computer and do therapy with me. So it's just beautiful whenever you find this world and how much you can help these kids. Amazing. I'm actually not checking the comments on Facebook. Let me turn my volume off. It is already, in case somebody gets a bingo somewhere. All right, here we go. Just so I can check. All right, where do we send if we get a bingo? You guys just type bingo really big, and then you can text me. I'll give you my number. Should I give you guys my number? You can text me a photo of bingo. Okay, here we go. Don't ever forget the people that got you where you are today. These 2 incredible people here are very, very dear to my heart. I was a dental hygienist. I was a dental hygienist for about 10 years. And I went into at the Hinman. Do you guys remember the Hinman in Atlanta? I went to the Hinman to get my CEs. And the last class on a Saturday was by this guy over here, Dr. Tom Cohort. And I am a firm believer that God works in very mysterious ways. And you guys can see the way that I'm looking at him. I'm just so thankful of him, of Dr. Tom Cohort. He said that he was not supposed to lecture that day. He said that somebody canceled and last minute they called him. He said, I'm a retired dentist. I don't do much of these anymore. And he was 74 years old at the time, and he was talking about how important it was to breastfeed your children until they were about 3 years old. I'm a huge breastfeeding advocate. And when he said that, I was like, hold on. I mean, everybody talks about your child is walking, they shouldn't be nursing. And here you are telling me that it's okay to nurse until 3. So I was sold, and as a dental hygienist, I feel like everybody that goes through to the dental field, we are very caring people. In any, type of therapy, also OT, PT, speech, we're very caring people. We love people. We want to help people. We want to care for people. And when we find out that there is so much more that you can do for somebody, to the point that you can significantly change someone's life, I was immediately sold. I was like, I need to know what this is. I had no idea that there was more that I could do, but in such an impactful way. So years after Dr. Tom Colquitt taught me that class, I mean, immediately I left there and I started researching everything that he told me. I started learning. And I saw him probably 3 years after. No, let's see, 16, 17, 18, 19, 20, 21. No, it was 6 years after. About 5 or 6 years after, I went to the Penny in New York to see him specifically because I knew he was going to be there. And it's an incredible meeting by Dr. Steve Lambert. If you guys have not been, it's called the Penny, Paanny. And I walk in there and I was like, Dr. Colquitt, it's such a pleasure to actually get in front of you again. And I told him in 2016, I was in your lecture. And I just want to tell you that it absolutely changed my life. He cried. And every time he saw me after that, he would cry. And he said to me that one of his mentors said, whenever you're teaching a class and you're able to change or really get to that one person, it was worth it. And he looked at me, he said, you were my one person, because I left there and I was able to create not only a very successful online practice for myofunctional therapy, but I also founded Airway Circle, and you guys are all here now. So none of this would be possible if it wasn't for him. So we love you, Dr. Tom Colquitt. And both of them, unfortunately, passed away last year. And Dr. Martha Cortez is from New York. This lady is the strongest woman that I have ever met. And she also taught me so much. If you guys are Airway Circle members, we luckily have many of her lectures recorded for you guys to listen to and to watch. And we have one from Dr. Tom Colquitt. Here we go. Let's talk about the tongue a little bit. Look at this organ that is inside our mouth where we work every single day. I hope it's playing for all of you guys. We work every single day. And we really fail to give the tongue the credit that it deserves. Look how much it works. It's working constantly. Your tongue position during rest is actually a function of your body. So all of you guys right now, one way or another, are using your tongue. And there is a proper way to use this tongue. Isn't that insane? Now, can you imagine if the oral cavity here was smaller? Would the tongue be able to do all of those beautiful movements with a smaller cavity? No, right? Now, let's say that tongue is way restricted to the floor of the mouth. Would that tongue be able to move as much as it's moving right now? So we just learned that the function is going to be impacted by the size of your mouth. How many patients do you guys get right here? Give me a percentage of how many patients you guys get over here that are that have crooked teeth, that have misaligned teeth. I'm curious to know, what would you say your percentage of patients over here have misaligned teeth? So if you don't have enough room for your tongue in your mouth, your function is going to be impacted. Now, if you have a restriction underneath your tongue, your function is going to be impacted. Now let's try something else. Everybody, you guys got to do this with me. You guys ready? Hold. Oh, you got bingo? Ashley already got bingo. Good job, Ashley. And who got after? Bridget, 75%. Very good. Ashley, take a photo of your screen and send it to me. I'm going to give you my number. Ready? Should I give you guys my number? I'm going to type it on the comments. Here you go. I'm going to type it in the comments. All right. So you guys text me. Ashley was first. Bridget was second. Yes, please don't spam me out. Okay, perfect. I have somebody messaging me right now. I'll get to you later. Okay, perfect. Now we're waiting for whoever gets the whole thing. I'm going to do this. I just came up with something. If anybody during the whole talk gets a line of bingo, all of you guys are still going to get $500 off from the course. And I'm going to give you also, let me think, $500 off from the course, which I'm not offering anymore. That one's closed. The promotion for today for everybody who doesn't get a bingo is $497 or $493 off. I'm going to post a link for you guys. However, if you get a bingo, you get a bigger discount. And let me see. I think I got her text. Oh, somebody else was tied with Ashley. Let's see. Oh, so she got sleep therapy, myo, and tongue tie. Good job. 1, 2, 3, 4, 5. Good job. Okay, Kristen also. Okay, I will post the link for the discount right here. Let me go ahead and post the link before I forget. The discount for the course is $457, so it's going to be $22.42 total. Let's see. Let me put this down. I'm just going to put that in the comments so I don't forget. But I want everybody to try something with me right now. You guys all close your nose. And I want you to pretend you're talking, or maybe you're eating, or whatever else you may be doing. And keep doing that for some time. Let's see how much longer you can handle talking, chewing, eating, tongue posture. Just sit there with your mouth closed and the tongue in the right position. How long can you do that? So there's 3 major things right here that are going to impact your tongue function. So number 1, nasal obstruction. Number 2, an oral cavity that is too small. And number 3, a tongue tie. We're not going to go into how to look for a tongue tie, I don't think, during this class. But let's talk a little bit about breathing. So, we talked about all the functions that the tongue is responsible to. That the tongue is responsible for. However, the tongue is responsible for a lot more. And let me see if anybody else is texting me. Okay, good. So the first one is breathing. And here I have a couple of photos. Can you guys tell me what is the difference between these 2 patients? Anybody? One of them. My students can't answer, though. It has to be somebody else. I want to give more gifts. What else can I give, Lottie? What else can I give to people who are getting the answers right? Megan, you can't answer. What else can I give away? I want to give some gifts away. What do we have left? Gifts? We have brochures. We have T-shirts. We have brochure, T-shirt, tags. Travel tags. That's for Airway Circle members when they first join. Do we have the ring lights? We have ring lights. Smile? This is not. No. Gift for me to give away. T-shirts. How many T-shirts do we have? No, not many. Is it all packed up already? Guys, I'm moving. So there's nothing else behind me. My house is half empty already. A cute young man. Yes. Very good, Airway. So the difference between these 2 patients is one of these patients is a nose breather and one of these patients is a mouth breather. How can you tell that? These are 2 different people. You can tell that one of them is a nose breather because the tongue, Laura, that is so interesting. So funny story is that first photo is actually my daughter. And I almost fell backwards when I saw this photo at the orthodontist office. But my daughter was a nasal breather. And she had a tongue position like that. There's a book right here, something about building a beautiful face or something like that. It's right there. It talks about the role of the tongue pushing on these structures to try to help it grow. So we do believe that during a certain developmental time, it is okay for the tongue to push forward like that because it's helping everything grow forward. However, the low tongue, that patient is too narrow. That patient is too far back. So the structure didn't grow this way because the tongue wasn't up there helping it grow. But it's because they have nasal obstruction. If you cannot breathe through your nose, you cannot keep the tongue like the top patient. The tongue has to be low. So this is something easy and great for you guys to ask in your dental office. Can you smile for me? And just keep smiling and see if you can see the tongue. See if you can see the tongue in between their teeth. But yes, that one is actually not a tongue thrust. So breathing, very, very important. Let's see what else. I have a third winner, not second line in bingo. Okay, I have a third one. You guys sent, the girls that are messaging me or the people that are messaging me, give me your name and give me your address too, depending on what I have left over here. Most of my stuff is already packed. And if I don't send anything now, I'll send it in July when I move. I will send a little gift to you guys. Okay, here we go. Actually, everybody who joins Foundation is going to get a really big gift. So excited. All right, here we go. What else do we have? So after nasal breathing, what else is the tongue responsible for? Tongue mobility is essential for effective sucking, and it enables the coordinated movements needed to create suction, maintain a seal, and rhythmically draw milk or liquid into the mouth. How are we drinking? How many kids do we see that just throw water in their mouth and they're swallowing without even, with so much air, and then they have tummy issues and they don't know why? How many patients are biting on the straw? You should use your lips only. So the right way to drink from a straw, you need to smile, place the straw in front of your teeth, wrap your lips around it, and drink. So the tongue should not touch the cup. The tongue should not touch the straw. Hey, buddy. The tongue should not touch the cup. The tongue should not touch the straw. And it should do a peristaltic movement. So this is how digestion initiates. It's this peristaltic, beautiful movement of the tongue. However, if the oral cavity is too small, if they have nasal obstruction, or if they're tongue-tied, the tongue is not going to be able to function that way. You guys see that there's a pattern to this stuff? So here's a little boy that just screamed in the background. He's 5 now, but this is Benny eating an apple. So the tongue is also responsible to help you chew your food. How, Renata, if you chew with our teeth? The tongue is actually moving, the tongue and the cheeks. It's helping move the food from side to side. So if your cheek muscles are too weak, whenever you're chewing your food, you're going to notice that we get food packed all the way on the insides right here. We call this a vestibule if you're not a hygienist. So on the insides right here, we're going to start packing a bunch of food. That's because the cheek muscles are too weak, and the tongue is pushing the food that way. So the tongue needs to be able to push the food into the teeth, and the cheeks are supposed to push the food back into the teeth so that the food stays on the chewing surface of the teeth. So that's another function of the tongue. What else? Tongue mobility plays a critical role in the oral phase of swallowing by helping to collect, control, and propel the bolus efficiently toward the pharynx. So swallowing, if the food goes through here and you have issues swallowing past this right here, past the mouth, then you send them to a swallowing expert, speech pathologist, feeding expert who will take care of this patient. Myofunctional therapy only looks at oral phase swallowing. What does that mean? That means exactly what it's talking about over here. Whenever you control the food inside your mouth, and whenever you propel that food, so you organize the food, and you propel that food to be swallowed. If there are any issues with that function, myofunctional therapy can help. After they swallow, if there's any issues right here, choking, swallowing the wrong way, they have to go see a speech pathologist. What else? Speech. Even though we don't deal with speech, but tongue mobility is crucial for clear speech production, and it allows for precise articulation of sounds through controlled movement and placement within the oral cavity. So again, being a myofunctional therapist allows you to step out of the box, and now you see the patient a little bit differently. Because as we talked about before, all of these tongue functions are being affected by other things. Many people who are not in this world may not know when somebody has a speech issue, they may not know to look at the nose. They may not know to look at the oral cavity to make sure that it's big enough. So it really just goes hand in hand. If you are practicing myofunctional therapy and you have a speech pathologist around you, please reach out to them. You guys can collaborate in so many cases, and you can really turn the light on to them. You know, if they're having kids with speech issues that are not getting better, for them to look at nasal breathing, for them to look at the size of the oral cavity. What else? Oral rest posture is a function. So that's talking about tongue mobility over there. But tongue posture is a function. The way that your tongue fits inside your mouth during rest is a function of your tongue. Over there, you guys are seeing 2 photos of me. The first one is before my tongue tie release. Look how much I can suction and open with a tongue tie. It wasn't bad. And also before my palatal expansion. Isn't it absolutely crazy how narrow I was and my tongue did not have enough room? So these are things that we're looking for. Your maxilla, your upper jaw is literally the house of your tongue. Your tongue has to fit up there. So we have to make a beautiful big house for the tongue to fit comfortably and work comfortably. So everybody, where is your tongue right now? Where is your tongue? You guys tell me. How much time do I have, y'all? Oh my gosh. Just to let you guys know, I'm on slide what? 5? I have 63 slides. I'm not going to do it. Oh my goodness. All right. Your tongue should always be lightly suctioned all the way up. Orofacial myofunctional disorders are conditions or behaviors that negatively affect oral postures and functions. Examples of OMDs include tongue thrust, low tongue posture at rest. It's actually a myofunctional disorder. Lip incompetence. What does that mean? If your lips are apart during rest, so they're like this, that's lip incompetence, whenever you cannot close them. Open mouth posture. Nobody yet has bingoed the whole thing. Open mouth posture, thumb and finger sucking and biting habits also. These behaviors can interfere with normal orofacial growth and development related functions. We talk about tongue thrust a lot. Tongue thrust is a condition where the tongue protrudes between the teeth during swallowing, speech, or at rest. Tongue thrust can be caused by various factors, including pacifier use, thumb sucking, mouth breathing, a hypoplastic maxilla, improper swallowing habits. A tongue thrust is a consequence to airway obstruction or reduced intraoral space. There again, too little intraoral space. If there's not enough room in the mouth, are there any dentists here in the room? Roof of the mouth. Are there any dentists here in the room? I would love to know because we get so many patients from our fellow orthodontists to fix this kid's tongue thrust, but there's not enough room in the mouth for the tongue. You cannot shove a tongue back into somebody's airway because it's in the way. I'm going on Facebook now to see if there's any comments here. You can't just push the tongue back into somebody's airway to fix a tongue thrust. Linda, thank you for being here, your dentist. Most tongue thrust is there because of not enough room in the mouth. So lack of intraoral space. So, and nasal obstruction, same thing. I mean, stay like this long enough and you're going to start sticking your tongue out. So a speech pathologist, a dentist, or an orthodontist can diagnose a tongue thrust by observing the patient's swallowing and speech patterns, as well as conducting a comprehensive oral examination. Treatment for tongue thrust may include exercises to retrain the tongue. However, you have to address nasal obstruction first, enlarged tonsils, and orthodontic treatment to correct a maxillary or maxillary hypoplasia, which means the upper jaw a little bit too small. How many, you guys tell me in the comments, can you see the video? Because I don't know if it plays on over here on StreamYard. But this is the daughter of a pediatric dentist friend of mine. She was actually one of my first patients, y'all. But look how much she'd stick her tongue out. She totally had a tongue tie. But she has the hypermobile tongue that I started calling, and now everybody calls the hypermobile tongue, the tongue that really sticks out. You can't see the frenum. But whenever they hold the floor of the mouth down, we can still see that they are still restricted. This child, within 10 seconds of holding water in her mouth to check for nasal obstruction, she was hyperventilating within 10 seconds. What is the prevalence of tongue thrust? Tongue thrusting, protrusion of the tongue between the teeth during swallowing, is estimated to range between 33 and 50%. That's a lot of the general population of school-age children. Higher estimates are reported for individuals receiving orthodontic treatment, 60 to 73%, or with dental malocclusions. In individuals with a temporomandibular disorder, the percentage of those with orofacial myofunctional variables is estimated to be 97%. So people with TMD, they have other muscle issues that we can help them with. And then open bite. Another thing that we see commonly that are sent to us is our open bite cases. Why? Why are children growing to have an open bite? Why are children growing to have a tongue thrust? Open bite malocclusion is a vertical discrepancy. So it's a change in the vertical of the patient characterized by a lack of contact between the upper and the lower teeth. Depending on the location of the teeth involved, open bite can be classified as interior open bite, usually the absence of the vertical contact between the maxillary and the mandibular teeth from canine to canine, or as a posterior open bite. So you can also have an open bite in the back. Anterior open bites are more common than posterior, with a prevalence of 16.52% in children and adolescents aged 2 to 16 years old. Similar results were found in other studies where anterior open bite was discovered in 17 to 18% of children with mixed dentition. Very good. So I am going to cut this short just because I talk a lot and I skip through things. How are we doing? How many more do you guys have to get the whole thing? I'm really, yes, make sure, Marie, make sure that you click on the link over there so you get to tonight's discount. You don't want to miss tonight's discount. I'll tell you when that expires. What day is today? The 3rd? That is going to expire on Sunday. So, oh my gosh, today is only Tuesday. I'm going to give you guys until Sunday. Sunday, the 8th, is the last day to have that discount that I just posted, if anybody has to go. However, let's go ahead and let me see if there's anything else here that I would like to show you guys before. And I'm going to open up for questions, and then I'm going to talk to you guys about the course. Here, we're going to go to Airway Circle. But look, I had so many good things to show y'all. Can y'all see that? Beautiful. So these are things that are red flags, and we are looking for them in the dental office. So the upper lip that is too small. How many of us have the upper lip that is just has disappeared? It's not even existent. That a lot of times has to do with the small maxilla. The maxilla has to support the upper lip, so it needs to come forward. Asymmetrical lips. This beautiful Cupid's bow that is way too enhanced, and the open lip posture right there. the corner of the lips that are too low and also asymmetrical, too much tension in the lips. Oh my gosh, I don't know if you guys can see my mouse. I'm running my mouse over it like you guys can see which photo I'm talking about. The lower in the middle, a lot of tension in the lips, and mentalis strain, which is this muscle overreacting right here. A lot of times whenever we see mentalis strain, it's actually a skeletal issue. So upper and lower jaw are too small. And then open mouth posture completely with chapped lips. Those are all things we're looking for. Crooked teeth, if they have malocclusion, it's a red flag. If they have an open bite, is a red flag. If they have overjet, is a red flag. And then we have overbite and overjet on that little child over there. What happens if they have an overbite? They have an overbite, they have reduced intraoral space. The tongue does not have a lot of room in there. If they have a maxillary cant, or if they have a posterior crossbite. I'm not going to go through all of them, guys, but high vaulted palate. Let's look for patients with that bubble palate or asymmetrical palate or V-shaped palate. This person on the lower left had palatal expansion done. So if you measure the distance between the molars in the back, that's usually what we check to see if they have enough room. I'm not reading. Can you guys see? You guys can still see what I'm showing, right? If it showed like they had enough room in between those two teeth. Oh, you guys can see my mouse there. Now I can see it. So if, oh gosh, I was not supposed to do that. Let me go back real quick. Okay, so if they measure this teeth right here, it's going to look like they have enough room in between. It's not showing anymore. In between the two teeth, but they're tipped. Can you see that all of those teeth are tipped? That is one of the cases of a patient having palatal expansion, and they either moved too slow, it was not strong enough, or the patient was too old, and it just tipped the teeth out. So that person really needs to get those teeth back where they were, and then have skeletal expansion done where they actually open up, split the bone, the maxillary bone up there. But if they have, what else? High vaulted palate, that's this one right here on the upper right, upper left is a bubble palate. On the upper left, it's I don't know my signs. On the upper right, enlarged tonsils and a bifid uvula. If you see that little uvula with a split in the middle, 78% chance of that patient having a cleft palate, a submucosal cleft. And then if they have a lot of wear, if they have linea alba, so if they're clenching and grinding their teeth, these are all things we have to look for. I am going to leave the rest of the class to teach whenever you guys are our students, but there's a lot of good stuff over here. This is a recent patient of mine. This is after one session. Actually, I had not done a session yet. I did an evaluation. It was a guidance call and then an evaluation, but we already give the patient so many things to do before they even start therapy. And she came back to me like that with her lips closed, breathing through her nose. Her eyes, also, there's a great change over here in her eyes. And this is what she looks like right now. It is pretty incredible how this child, because as soon as I saw her, I was like, okay, forward pull face mask. We got to bring the maxilla forward. If you guys don't know what that is, it's a device that pulls the maxilla forward, opposite the headgear. But look, her teeth are moving. Isn't that insane? Her maxilla is not growing, but her teeth are moving. So we're still sending her. She has an appointment with the orthodontist. But this is myofunctional therapy. What else do we do here? She had adenoids out, lip tie, tongue tie released, and we're starting palatal expansion now. Every patient is different. So there are so many things that you guys are going to learn in this course to be able to look at, but mainly how to do a really good evaluation in a patient, and then how to treat somebody for a tongue tie release. This link right here is for the wait list. If you guys are not ready to take foundations right now, join the wait list. I'm going to leave this on, and I'm going to put the link for foundations again in the chat box. and I am open for questions. I would love for Megan to come on. Megan, are you still here? Is there anybody who is here and has taken foundations and would like to say hi and tell everyone about your experience? I am going to, I wonder how I can invite you as a speaker, Megan. I'm going to click on the bottom right here, and then I'm also going to share you guys, show you guys invite right here. Megan, I'm going to send you a text with the link for you to come on live. But we're going to have somebody fill up the whole thing. How many do you guys have left? How many words do you guys have left? Let me know if you can join. I sent you a link. Let's see who has the least amount of words left to fill out the whole thing. And then I'm going to now, let's see, stop the share. Let's see who has the least amount. So 3 more, all about tongue ties. 7 more. 6 more. How many else do you guys have on the bingo? Let me check on Facebook to see if anybody has won anything over there. 6 more on Facebook. So far is 3 more right here. 6, 7. All right, Ashley, take a photo. We're going to verify, make sure I said all those words. Take a photo and send it to me. Look who is here. All right, before I share a little bit more about the course with you guys, we have Megan.
You totally caught me off guard, so sorry.
Well, thank you for being here. Can you just tell everyone a little bit about your experience?
Okay, so Foundations was incredible. There was a lot of information, a lot of, I don't know. I mean, help me out, Renata. We literally did a lot. I mean,
why did you decide to go with foundations instead of something else?
Okay, so I had a couple of courses that I was looking into, and I liked that Foundations had multiple mentors, multiple people to learn from. And so that's what got me.
Very good.
Because everybody else was like 1 or 2 people.
Yes. And how were you able to see patients right away? Did you have a form that you were able to follow through to be able to do your clinical exam, your functional exam?
Oh, you guys gave us everything. I incorporated everything that you gave us, and I don't know. Okay, so I am a hygienist, so I was looking at my patients as I was going through the course, and so I was like, oh my God, this person's got a tongue tie. This person has a narrow palate. Why haven't we talked about this or looked at this? Or my mind was blown. And so at the end, I had been talking to my patients for 6 months now about it, 3 months now about it. And so when I was re-seeing them, they were like, oh, you talked about this last time. Now you know what's going on. So
I actually have a surprise for this foundations class that I did not give to you guys. Let me put it on the screen so everybody can see. And I know that you're going to love this.
I'm already jealous about their 4 months of
4 months of let's see, share screen, window, this one. Can you guys see that?
I cannot see it.
Let me see. Okay, there it is. There it goes. Marketing materials. So this is a link to templates for everything that we offer. And you guys are going to be able to simply click on this and make it your own. So all of this is already done for you. all of this, even email signature, everything, your evaluation, all of these forms are done for you. So for example, if I click on goals of Myo, it's not going to open up in this screen. Let's see. Oh, it is going to open up. Can you guys still see it? Awesome. Okay. So here's my template. You guys can literally come edit this template and you can put your own. It's going to fix it. You're going to be able to put your own logo, your own colors, all of your company's information, and use it yourself. I know, right? Isn't that incredible? I was so excited. I was like, you know what? All of the forms, so the HIPAA form, the all of the forms that you need for your practice. So not only you're going to learn myofunctional therapy, we're going to get you even more ready for to be able to start seeing patients. How did you feel seeing your first patient? How scared?
Oh, I was super nervous, but this is one of my patients that I had been, she was my hygiene patient for forever. So she knew I was new. She knew I didn't know quite what I was doing. I fumbled my way through it. It was fine. It's just like seeing your first hygiene patient. You know, you literally fumble your way through it.
But how awesome to be able to have something that you could follow through.
Oh, it was perfect.
And you were able to do it in the course. So you already knew how to do it. This time around, we're going to be doing it on each other. So I'm super excited for you guys to practice many, many times on doing it on each other. And then we're also going to have some patients present and everybody's going to sit and watch 8 full evaluations. So not only you're going to be able to do the evaluation on yourself, you're going to watch other people do it. And like that, by the time you guys are done, you'll be ready to see them. Megan, thank you so much.
You're so welcome.
And then you took Myocircle.
Yes, I did. And that was that was awesome. That was like the best. It was like I like how you're doing it now. My foundations, the Myocircle. It's like a complete package. It's perfect.
Yay! Thank you, Megan. Have a good night.
Thank you.
Let me share the screen of the course for you guys. So here we are. This is Airway Circle. Let's see. You're going to go to courses, foundations. Beautiful girls who helped me put all of this together. So here we are, some of our students. I can tell you one of the mentors for this year is Veronica. She's right here. She has taken several of our courses. She's been with us for a while, and she was a mentor last year already. So I need to count the hours again, but there are many, many hours. It's going to be over 12 weeks. Here are the modules for the course. So we start with an intro to myofunctional disorders. Then we go to head and neck anatomy review. It's always good for us to review these things. Orofacial myofunctional assessment protocols. What kind of protocols are out there and why do we use what we use? You guys are going to see that many courses, they just come up with their own thing. However, all of the protocols that we use are protocols that are validated and we pull from those protocols. Templates and intake forms. We're going to go through what we do. A guidance call. A guidance call is that welcome call the first time that you have with the patient in front of you, and you guys are going to be able to see several examples of how we do that. Myofunctional therapy full evaluation. So then we're going to go into the 2 assessments, the clinical assessment, what you see, and the functional assessment, what the function of those muscles look like. You're going to see several of mine, and there are some of Tamara's also, how we treat our patients. So you can see from both of us. Myofunctional therapy exercises, there are so many of them. I had only released a few, and I think it ended up being like 75 exercises. There's a lot of exercises. Therapy sessions, step by step. You're going to be able to shadow us. I mean, it's so important for you to see somebody work. So here we are seeing real patients, and you're going to be able to follow along and learn from every single patient that we see, different ages, different conditions, and how we interact with them, what kind of questions we ask, and what kind of exercises recommend them doing. Therapy recommendations. There are lists of things that you're going to be able to already recommend to your patients. Myofunctional therapy treatment protocol. This is the protocol that I have come up with to help you guys. It's a phases protocol, phase 1, 2, 3, and 4. And it gives you a very clear guide of how to see these patients, what to do in phase 1, what to do in phase 2, what to do in phase 3. And he also gives a clear guidance to the patient so they know how much longer they have with therapy. This by itself is going to increase patient retention. We go heavy on oral ties over here. So you guys are going to be able to really treat some before and after therapy for oral ties. Super exciting. And we talk a little bit more about sleep disordered breathing. So here, if you guys want to join, it's right there. What else do you get though? Because we love giving bonuses. So you're going to get the Airway Circle membership when you join. It's a $450 value, and you get a whole year of the Airway Circle membership for free as soon as you sign up. So if you sign up today, Airway Circle membership is already open for you. Make sure that you're going to get an email with the link. Make sure that you look at that link. Check your spam, okay? The customizable office templates, what I just showed you guys, it is priceless. People charge a lot of money to have those templates. This is not a PDF that I'm giving you. I'm literally giving you the template on Canva that you can edit yourself. You don't have to rebuild it. That's going to save you many, 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 many hours, especially if you're not tech savvy or graphic designer savvy, graphic design savvy. It's going to give you everything that you need to start your practice. And then brochures, you get 100 brochures. It may be, yes, what is myofunctional therapy? We got to see what we have left over here. What else? What else? Tamara and I are the main mentors. There we are. And then if you guys want to see the live sessions, when are the live sessions? They happen weekly. It's going to be on Tuesdays at 8 p.m. and they last about an hour. And there are 2 Saturdays. I already have the dates. I'm not sure why they are not showing up here. I'm going to check. But all the sessions are recorded if you cannot be there live. So Tuesdays at 8 p.m. Mark your calendars starting after August 1st. If you guys do not want to do the whole payment at first, you can do a payment plan. So pay in 3 installments right here. Just click on this link and it takes you to the payment plan. The payment plan does not give you a discount because there's huge fees with being able to do a payment plan. You can also, very important, Foundations of Myofunctional Therapy and MyoCircle are both eligible for IOM active membership and certification enrollment. Does anybody have any questions how to get certified? First of all, you do not have to be certified to practice. It's going to take some time, about a year or so, for you to be able to apply. You have to have completed cases. You have to have more experience. It's a long process, but it's very worth it. I highly recommend everybody getting certified through the IAOM. It's the only gold standard right now. We have letters that we can give you guys to put after your name after you complete our courses. However, the only gold standard of COM, the letters after your name, certified orofacial myologist, is through the IAOM, because you take courses from other people and they test you. It's not the same people testing you and giving you the letters, if that makes sense. It's $26.99 investment. Remember, this is an investment. You're not spending this money and you're not getting a return. This is literally one patient. If you graduate and you get one patient, you get your investment paid for. However, we even have a discount today. So our discount link, it's right here. I am going to put on the chat box right here for you guys. And I'm also going to put the discount. I have too many windows open. Let's see where I am. And I'm also going to put a discount in Facebook. So today until Sunday, it's $4.57 off. So due today, it's $22.42. If you guys want to sign up with a friend, message me. I'll give you a bigger discount. If you guys have any questions, ask me right now. You have me in front of you. I am here to answer any questions you may have. If you're watching this as a recording, the discount may not be available anymore, so reach out to me. Questions? Anybody? It is 2.0 cohort. How long is the course? The whole course will last around 12 weeks plus 4 months of group mentorship. So we're going to have monthly meetings for 4 months for us to be able to share cases, go over patients, talk about what else is going on in the world of myofunctional therapy, and you guys starting your own practice. Time commitment. Each module ranges from 30 minutes to 4 hours. So it's actually more than 40 hours of recorded content plus an additional, 40 hours of recorded content plus 20 hours of live meetings. You can watch all of the recorded videos on your own. Also, you have access to the course forever. We also have a WhatsApp group that is absolutely amazing. You get to talk to each other. You get to create that community, everybody that you graduated with. And we had foundations last August. That group is still active. People are still talking. What else? We do have a refund policy. We offer a partial refund within 24 hours of purchase. We just take out the processing fee that we have to pay. And then course credit after, if requested within 30 days of the course start date. But if there's an emergency or anything like that, you guys just reach out to me. We're super laid back about that stuff. But I tell you guys, with MyoCircle, I always say, if you don't learn anything within the first 30 days, we'll give your money back because this will blow your mind. We're super excited. These girls helped me put MyoCircle and foundations together. They have been not only mentors, but volunteers with Airway Circle for a long time. But they're all doing their own thing now besides Tamara. Tamara's still with me. But I love them. I'm so thankful for Madison, Angela, and Kimmy. However, they are not active members or mentors right now. They're still, some of them are still mentoring Myo Meets, which are the graduates of MyoCircle. So you guys are still going to see them here and there. Any questions? You guys are excited? So you get huge discount. You get free Airway Circle membership. You get brochures. You get the templates for your practice and 4 months of mentorship and a huge bag with a gift and the tongue-tied book, if you don't have that yet, by Dr. Richard Baxter. Guys, this has been an incredible night with you guys. It was last minute. I'm still all crazy over here from packing all day. If you have any questions, you have my number because I put it on the, I put my phone number in the chat box. So you guys are welcome to text me and call me afterwards. Ashley was the only one that only had 3 left. Yes, Ashley was the only one with only 3 left. So Ashley, you win the big prize, which is a... Everybody ready? You get 50% discount the foundations course. If you're not ready to take foundations right now, you get a free yearly membership for Airway Circle. So congratulations. We're super excited to have you guys. I think that you sent me the photo of your, yes, you sent me. Oh, here we go. I'll show you guys. Let me stop sharing my screen so I can show you guys her card. If anybody else had anything similar, let me know. She didn't. Frenulum, frenectomy, and tethered. She did not have. I was not ever going to say tethered. I don't like that word. Tethered or tissues. Very, very good. Good job, everybody. That was fun playing bingo with you guys. Seriously, there's still 12 of you guys here. Text me, call me, let me know if you have any questions about the course. If you want to look inside the course, I will have a private meeting with you and I'll open the course for you so you can see it. You can see how many lectures, you can see what they look like. But I know that if you want to become a myofunctional therapist or practice myofunctional therapy, because it's not a profession, it's a modality, we would be honored to have you as part of our community. We have a really cool group. And anyways, if you guys have any questions, let me know. The code is red flags for $400 and something off. All right. Love you guys. Thank you so much. Have a wonderful night and we'll see you August 1st. Bye-bye.